you've ever looked in the mirror and noticed your skin isn't quite as firm as it used to be, you are not alone. Skin laxity is one of the most common concerns I hear about in my practice. And the good news is there are several non-surgical, evidence-based treatments that can really help you. So today I want to walk you through the top 5 skin tightening treatments that actually have solid clinical research behind them. Hi, I'm Dr. Morgana Colombo. I'm a board-certified dermatologist and founder of Vida Derma, a science-backed skincare line. Before we dive in, let me tell you what's really happening when your skin starts to loosen. As you age, your body produces less collagen and less elastin. These are the proteins that give your skin its structure and bounce. Sun exposure speeds this process up. The result is sagging, fine lines, and a loss of that firm, youthful contour, especially around the jawline, neck, and around the eyes. All 5 of the treatments I'm going to cover work on a similar principle. Skin tightening treatments that can be done in the dermatology office deliver controlled energy into the deeper layers of your skin. This energy creates a mild, targeted injury that your body then repairs by producing fresh collagen and elastin. Think of it as kickstarting your skin's own natural repair system. So let's get into it, guys. Number 1 is monopolar radiofrequency, also known as thermage, one of them. This is often considered the gold standard for non-invasive skin tightening, and it has some of the longest track record in the research. Monopolar radiofrequency uses electromagnetic energy to heat the deep layers of your skin, the dermis, to a specific temperature. That heat causes existing collagen to contract immediately and then triggers new collagen production over the following months. A systematic review in plastic and reconstructive surgery found that monopolar radiofrequency produces measurable improvement in skin laxity, both in the face and body, with most side effects being minor and temporary. So in my experience, patients often notice gradual tightening that continues to improve for up to 6 months after treatment. Number 2 is microfocused ultrasound. You may have heard of this by its brand name, Ultherapy, or their softwave, but the technology itself uses focused ultrasound energy to reach even deeper tissue layers, including the muscle layer beneath the skin. A large meta-analysis found that about 89% of patients showed some degree of aesthetic improvement after treatment, and 84% reported satisfaction. It's particularly effective for lower face, neck, and brow area. One thing I always tell patients is that for most in-office energy treatments, the results are not instant. It takes time for your body to build that new collagen. So expect to see best results around 3 to 6 months after your session. And the earlier you start, the better results you get. So start this stuff in your 40s, guys. Bank collagen. Number 3 is radiofrequency microneedling. This treatment combines 2 technologies. Tiny needles create microchannels in the skin while simultaneously delivering radiofrequency energy directly into the dermis. A comprehensive systematic review found that radiofrequency microneedling is safe, well tolerated, and effective across multiple skin types, including darker skin tones, which is an important advantage. RF microneedling is especially useful for lower face, jawline, neck. Studies show that it improves wrinkle scores, increases dermal density, and stimulates both new collagen and elastin production. Compared to standard microneedling alone, the addition of radiofrequency energy produces greater clinical and histological improvements. Downtime is minimal. 1 to 2 days. It's really just a little bit of redness. Easy, great treatment. This one I tell people to start like mid-30s to really prevent aging. Number 4 is fractional ablative laser resurfacing. This is one of the more aggressive options on the list, but it also tends to produce the most dramatic results. Fractional CO2 lasers create thousands of tiny columns of controlled injury in the skin, leaving surround skin tissue intact, so healing is faster. Research shows that this process reverses many age-related changes in gene expression and triggers robust extracellular matrix remodeling. Fractional ablative lasers are particularly well suited for patients who have significant sun damage along with skin laxity. The trade-off is more downtime, typically about a week of redness and peeling, and it may not be the best first choice for darker skin tones due to a higher risk of pigmentation changes. Multiple sessions often produce the best results. Some brands are, the Ultra Clear, which is fractional erbium, the Core, which is a fractional CO2. Number 5 is microneedling. Standard microneedling without the radiofrequency component is the most accessible option in this list, the cheapest one. It uses fine needles to create controlled micro-injuries in the skin, which triggers your body's wound healing response and stimulates collagen production. A recent meta-analysis of over 700 patients found that 83% reported satisfaction with their results, and adverse effects were minimal, mostly just temporary redness. Microneedling is best suited for mild skin laxity, fine lines, and overall texture improvement. It typically requires multiple sessions, usually 3 to 6, spaced a month apart. While the skin tightening effect is more subtle compared to the other treatments on this list, it's a great entry point and safe for all skin types. Again, something that you can start in your 30s, and it's a great maintenance treatment in between the other treatments I mentioned. Now, here's what I want you to take away from this, guys. Not every treatment is right for every person. The best option for you depends on your specific concerns, your skin type, how much downtime you can handle, and your overall goals. Mild laxity might respond beautifully to microneedling or radiofrequency microneedling or radiofrequency, while more advanced sagging and sun damage might call for fractional laser or a combination approach. And it's worth knowing that many clinicians, myself included, often combine these treatments for best possible outcome. One more important point, these treatments are powerful tools, but they work best as part of a comprehensive skincare plan that includes sun protection and good daily habits. And of course, results may vary from person to person based on age, skin quality, and individual healing response. If you found this helpful, make sure to subscribe, leave a comment below with any questions. And if you're considering any of these treatments, remember to talk to a board-certified dermatologist who can evaluate your particular skin and help you choose the right approach for your goals. Thanks for watching, and I will see you in the next one.